So you have two of the biggest superstars in this space who have traveled here to join us. Dr. Joe Goldstein is coming to us. Come on up here, Joe. From Harvard and Mass General, and she has started something called the Women's Brain and Heart Global Initiative. She is regarded as a warrior and a revolutionary, and she said to me today in my office, I want to revolutionize the way we think and deal with Alzheimer's. And I said, perfect, we're mutually aligned. And Dr. Josh Grill, who is at Irvine, UCI Mind at Irvine, and he has been a partner with us in funding research. He was here at UCLA and is now down there and doing extraordinary work at UCI, and both of them have areas of expertise that I hope will help you not only find out where the latest research is, but it will empower you to know what you need to know and what you can do when you leave here tonight. So I told Jill, let's make this the kind of coffee table conversation when you get in the car with whoever you're getting in the car with, and if you're getting alone, write it down. But you're going to get news you can use tonight. That's the goal, and then I'll put you on your way. So I want to thank both of them so much. I'm going to talk to them about 20 minutes, and then we're going to open it up to questions. And they are rarely here, and they're rarely out of their labs and their towers, so I'm really deeply grateful to both of them for coming here to share what they know with all of you. So let me begin with you, Jill. Thank you so much for being here. You said today you want to revolutionize the way people think about Alzheimer's, what they know. What is the most exciting thing to you right now? As I said, you have started at Harvard the women's global initiative called the Women's Heart and Brain Initiative. And what can you tell people today that they didn't know 2 years ago?
So I think one of the things we need to think about aging of the brain is that aging of the brain is actually about development of the brain. And that aside from the fact that we think that Alzheimer's disease really begins 10 to 15 years before symptoms, in fact, it can even begin in fetal development. And so this initiative we've launched is actually to think about chronic diseases like diseases of the heart and the brain, depression, its comorbidity or co-occurrence with cardiovascular risk, and the risk for memory decline, and how these disorders actually are higher risk actually in women. So for example, depression, twofold risk in women, and actually emerges just post-puberty. Depression also is highly co-occurring with cardiovascular disease down the road. Heart disease is the #1 killer of women in the United States and in most middle-income countries. And so with the co-occurrence of depression and cardiovascular disease, that is actually going to be the #1 cause of disability worldwide. And women are twice the risk for that. And so these two chronic diseases that are the primary cause of disability worldwide actually are risk factors for Alzheimer's disease and actually shared causes occur early in development. So that we can target our therapeutics, we need to enhance our understanding of these early shared causes and target our therapeutics early. We could be targeting our therapeutics in early adolescence, just post-puberty, for Alzheimer's disease down the road. So we want to revolutionize the idea of the aging of the brain to think about what we can do in development. And I think later on we'll talk a little bit about what are those things we can do. 95% of cardiovascular disease is modifiable. It's one of the major risk factors for Alzheimer's disease.
But what's exciting to you now, today? What makes you excited and hopeful for those people who perhaps are in their 40s, 50s, and 60s and are feeling vulnerable with their brain?
Yes, what makes me excited is that we can begin to study and enhance our discovery of these early causes so that we can target them early to prevent Alzheimer's disease down the road. We know stuff about this. We know how to treat stuff about this, and we know that women are at higher risk for the co-occurrence of these things. And so what I'm excited about is the development of therapeutics to translate the knowledge into therapeutics that we can target early over the course of our lives.
Josh, I was talking to somebody here at the cocktail party who said, I'm struggling with remembering names. I'm struggling with, certain parts of my memory. That's normal, right? And I hear that all the time. You know, people come up to me like, I can't remember the name of somebody that I know, and does that mean I have Alzheimer's and it's on a plane or I'm walking in the airport? I'm like, no, it's okay, it's okay. But you study memory, and what would you say to someone who is, let's say, 50, and they're beginning to struggle with their memory?
Let me begin by saying thank you for letting me be a part of this incredible evening. I get that question a lot too. And I think that what I like to remind people is that when we look in the mirror, we all notice that we're aging, but we can't see our brain in the mirror. And as we age, our brain, like the rest of our body, is certainly changing and having more difficulty than we used to have with coming up with something quickly or making decisions quickly, processing things quickly. It doesn't necessarily mean that we have begun going down a trajectory toward Alzheimer's disease. Now, the disease in and of itself, by definition, is a slow and insidious onset, meaning we can't, it's not like a stroke. We don't say, Mom got Alzheimer's disease on May 3rd, 1987. It just isn't that simple. And that gray area in between what is normal aging and what is the onset of a disease is going to be critical as we move forward in trying to start early therapies. Some of the therapies that are in development now are extremely promising, and they have risks. So we're going to have to figure out when is the right time to start those treatments and in whom. And screening tests, memory tests, someday blood tests are all going to be vital to instructing those decisions. And I absolutely agree. Prevention is the only way we're going to absolutely curb the public health impact of this disease.
There's a lot of misconception. People say to me, oh, I'm not going to get Alzheimer's because I don't have the gene. That's not true, by the way. And if you have the gene, that doesn't mean you're also going to get Alzheimer's. But I try to tell people anybody with a brain should be concerned about getting Alzheimer's. So that means every single person in this room should be concerned about Alzheimer's. And since we know that it begins to form, as you said, in the brain, 15, 20 years in development, after pregnancy, whatever, what can people who are in this room, what should they know? What should they do?
Yeah. So I totally agree. The strongest risk factor for Alzheimer's disease is age. So unless you know a way to stop the aging process, this is a disease that could impact you. And just as importantly, we've heard from the beginning this evening, this is a disease that never affects just one person. So all of us will have our lives affected by this disease if they haven't already been. What can you do? Again, I agree. It's never too early to start thinking about brain health. And repeated studies have shown that midlife risk factors, especially cardiovascular risk factors, are linked to late life outcomes, including the risk for getting this disease. And so if you smoke, stop. If you have high blood pressure, work very closely with your doctor to get your blood pressure down. If you have high cholesterol, control it. Again, working closely with your doctor. There are estimates that in this country, if we could reduce some of those cardiovascular risk factors by 25%, we could cut the total number of cases of Alzheimer's disease by 500,000 today. So these things are meaningful, they are impactful, and last week a clinical trial yielded results that controlling blood pressure could actually reduce risk for developing cognitive impairment and dementia.
So those are things, we were talking today, Jill, in the office about depression and the connection between depression and Alzheimer's. Can you talk a little bit about that link and why someone who may be struggling with depression, whether it was depression that came on at an early age, whether it's postpartum depression, whether it's menopausal, perimenopausal depression, how that puts you more at risk and what you can do about it?
So, number one was brain aging is about brain development, right? Number two is your brain health is your heart health. So your brain talks to your heart, and it does so differently in men and women, and it does so differently beginning in fetal development. And what we have done is we study the circuitry in the brain regions that regulate stress. Now, stress affects every chronic disease we know. Stress affects everything. This is stressful. How am I regulating it? Stress is not only affects every chronic disease, including depression, including heart disease, and including Alzheimer's disease, but the brain regions that regulate stress have some of the largest sex differences in the brain in both structure and function. So they develop differently in the male and female brain, and they function differently across our lifespan. And not only do they regulate stress, but they regulate mood and anxiety. They regulate our physiology, our hormonal physiology. They regulate our immune physiology. And we know that immune function now is really important in how we might combat Alzheimer's disease, for example. And also they regulate the heart. And finally, some of the same brain regions regulate memory. So these things develop in different ways in the male and female brain to both regulate our mood, regulate our heart, and regulate our memory. And what we've been looking at, we've discovered that there are shared causes to the disruption of this circuitry in development that lays the vulnerability for why we see sex differences between men and women in the onset of major depression, in the onset of its co-occurrence with cardiovascular disease, and in that same person, risk for Alzheimer's disease 60 years later. And so what we're trying to do is to target these shared causes early. So thinking about, as I said before, your cardiac health, 95% modifiable, 95%. So if we know that that person may be at risk for Alzheimer's disease later on, and we know, frankly, if there's undiagnosed and untreated major depression, which we believe is one of the primary reasons, aside from the difference in our vasculature, for why women are dying at a higher rate of heart disease than men, even though most of us in this room probably figure it's a man's disease. In fact, it's the #1 killer of women, as I said, in the United States and in other middle-income countries. So these are problems we can tackle before the amyloid and the tangles occur, which is, to my mind, a really optimistic way of thinking about Alzheimer's disease.
One of the other things we were talking about, my experience is that when you go to your doctor, most doctors don't know anything about your brain health. They never ask you about your brain health, and when you go to talk about your brain health, you're often told you're stressed, take a vacation, take a couple days off. And one of the things that I'm really trying to stress for the women's Alzheimer's movement is to educate people to go into their doctors and talk about yourself holistically, to educate the doctor about your holistic health. So do you have cardiovascular health? Do you take medication for depression? What impact does your heart have to your brain? And when it comes also to women who are perimenopausal, menopausal, or postmenopausal, the issue of hormones and cognitive health is the #1 issue that women are talking about, and the confusion is massive.
Yes, I'm asked this question a lot, as I'm sure you are as well. Women's health is not bikini medicine. Let's put that out there right now. Because most of the time people think about women's health as reproduction. It's just about the differences in our reproductive systems. And there are still people who think that way. But women's health is actually much more about our overall health. As I just told you, the brain regions that regulate lots of things that are how we function in life under stress or mood or anxiety or our hearts are different in the male and female brain. And they function differently and they get disrupted differently in the male and female brain. And one of the reasons for that is that hormones, like gonadal hormones, like estradiol, which is the primary form of estrogen that works in the brain, is really important for our memory function. That's been found to be absolutely true. And so why is it that, and in fact, actually, women have a leg up in memory for words. I'm going to say that again, because we should have protection from Alzheimer's, right? Because we actually have a leg up just post-puberty compared to the male brain in what's called verbal memory, memory for words. So why is there higher rates of Alzheimer's disease, right? Because these hormones also have other effects, for example. And also there are other causes to Alzheimer's disease than just hormones. But hormones are really important. So why are we told you shouldn't be taking it because there are death rates from that, for example? I mean, we were really scared. Doctors were scared, just kind of put the kibosh on using hormones. But in fact, now recent research really shows that during the perimenopausal transition and early menopause, in fact, while receptors in your brain that can actually handle the hormones are still active, that now hormones like estradiol, taking it as a patch or a route for oral, depending on your physician, is still really good for helping to maintain intact memory function. And by the way, it also helps your vasculature and your bones.
So we said at the beginning of the evening that Alzheimer's, 2/3 of the brains every 65 seconds were those of women. African Americans, twice as likely to get Alzheimer's. Latinas, 1.5 times. What is your estimation? And we have been at the Women's Alzheimer's Movement trying to get that message out into different communities. What is your hypothesis as to why that is today?
Yeah, it's a really critical question because the burden of Alzheimer's disease isn't necessarily evenly distributed. And women bear the burden more than men, clearly, not just in getting the disease, but overwhelmingly in providing care. And then among particular communities in this country, African Americans and Latinos do bear a greater burden of Alzheimer's disease. The risk is higher. There's disparities in diagnosis rates, treatment rates, so it's a big problem. Why it is, certainly all the things that we've talked about to this point, cardiovascular risk factors in early and midlife can differ in those communities, which increase risk. The genetics of the disease is largely still not yet understood, and whether race and ethnicity vary in the impact of particular risk genes is a highly open question. One of the biggest challenges to understanding this is that overwhelmingly our research has been done with white people and highly educated, affluent white people to boot. So there's
older white people.
Of course. And so there's a major push now to do a better job as a research community to be inclusive in our research. And that goes for our natural history studies as well as our clinical trials, because in other areas of medicine, we know that the safety or even the efficacy of new treatments could vary by genetics and by race. And so it'll be critical as we push forward in developing new therapies to understand whether drugs are just as safe in all the communities that are suffering from this disease. And maybe even more importantly, what if we had a drug that only worked in a specific population, but we didn't have adequate numbers of that population in our studies? We want to make sure we find any effective therapy and bring it to the people who could help as quickly as possible.
One of the things we try to stress also at the Women's Alzheimer's Movement is to participate in a clinical trial. I call that a form of national service. We really need people to participate in clinical trials. There's a dearth of people doing that, and these clinical trials are now looking at younger people. The exciting thing, I think, in this space is that it was always looking at people who had Alzheimer's, who had plaques and tangles, and those studies failed. And now the kind of shift in it, like, let's go younger. Let's look at how the brain changes once you've had a baby. We're now looking at, women's health lags far behind, but now looking at, what's happening in the brain of a woman when she has a baby? What's happening in the brain of someone who's depressed? How does that connect to someone who might be developing mild cognitive impairment? So we talked a little bit about depression, but
really important. So metabolism in our body.
I think Alzheimer's, type 3 diabetes, on a fast track. What do you feel is the connection?
Actually, this is a great tie-in with the last comment, because African American women have the highest rates of diabetes of any group. And diabetes, cardiovascular disease, depression, and diabetes are the three chronic diseases that are risk factors for Alzheimer's disease, because metabolism in the brain is really important. So metabolism in our body actually reflects also metabolism in the brain. And diabetes is actually a risk factor, can be for memory decline. And diabetes is one of the reasons why there may be higher risks in some of the African American communities among the women. And that is treatable. It is treatable with modifiable lifestyle, but also with medications. I mean, we know a lot about diabetes to tackle. So I just wanted to mention that. In terms of pregnancy, so one of the things that Marie and I were talking about were, well, how early can you go? How early can you go to try to think about Alzheimer's disease? Well, actually, we talk about pregnancy. Actually, we talk about pregnancy risks in the mother and the impact on the developing fetus in the male and female fetus. So complicated pregnancies like preeclampsia or things that produce fetal growth restriction actually place the mother at a higher risk later on in life, after preeclampsia is gone, for cardiovascular disease, and later in life even for major depression in some people, and finally even later in life, memory decline. So if we know a pregnant woman has a complicated pregnancy, we need to make sure that woman is going to their doctor to prevent cardiovascular disease. And in that same woman, we'll be preventing lots of things down the road with aging, including Alzheimer's disease. So these are some of the moments in which we have these windows of opportunity, I call them, when the brain and the body are either differentially flooded with gonadal hormones or depleted of them in menopause. And in fetal development, in puberty is another really important emergence of depression, also in pregnancy. So these are moments in which we can capitalize on intervening early before Alzheimer's occurs much later in life, because who's thinking about Alzheimer's when you've just had a new baby? Or even cardiovascular disease. You're young. Why would you think about it? They're modifiable at that point. That's the trick.
What is the trick and part of the reason that we like to do these events is, as I said, to educate people so that you are informed when you go into your doctor's office, because most people, and I've had this experience myself, their doctor doesn't know any of this. Yeah. Why is that?
Well, let me explain the medical profession. You know, I think we have a lot of people come to us who've been seeing the same doctor for 40 or 50 years, and brain health isn't top of their radar. And of course, medical doctors are faced with increasing challenges of less time to spend with each patient to survive. And so when people are worried about memory problems or brain health, we recommend that they seek out someone with true expertise on that, who can afford to take the time to work closely with them and really learn about their overarching health condition and whether they have concerns about memory performance and the like. So I think that that largely fits in the context of the importance of early diagnosis. But I totally agree with the other comments. And one thing I was thinking about is when we had children, how little sleep I got, and how one risk factor that we haven't really talked about tonight that we probably should is sleep, because increasingly there are just numerous studies that are linking the quality or quantity of sleep that an individual gets to the health of their brain and indeed their risk for getting Alzheimer's disease later in life. So another recommendation that we're frequently making is to make sure you practice good sleep hygiene, and if you're having trouble with your sleep, that you, again, find a physician who feels comfortable working with you to talk about how your sleep is and trying to improve it, not necessarily through pharmacology, but if necessary through pharmacology. And there are a lot of recommendations that we can make to folks to try to improve their sleep without drugs. And if those don't work, then we really recommend people go to a doctor.
So the doctor that they would seek out would be a neurologist?
Potentially. There's a wonderful sleep center at UCLA. There's a new sleep center at UC Irvine. The reason I bring up those two is that the sleep center at UCLA is run by a neurologist. The one at UC Irvine is run by a psychiatrist. So it's really about having trained in sleep medicine. There are numerous specialties who can do that.
So we've also talked about, it's important of all the researchers when I go around the country, is that they said they want people to understand that we're now entering an era of personalized precision medicine. So in what that translation of that means is what works for you doesn't work for you. It doesn't work for you, and it doesn't work for you. And so we each have to be our own advocates. You have to understand your history, your own brain, your own cardiovascular risks, your own history, whether you have depression, diabetes, whether you metabolize sugar, how you handle it, because what I'm taking may not be what you're taking.
So a couple of things I wanted to just respond about medicine, which is medicine has grown up in silos, right? You've got your cardiologist, you've got your neurologist, you've got your psychiatrist, you've got your OBGYN, and never the twain shall meet, right? Because we've become such a specialized because of all the technology, and this is wonderful, all this new knowledge. How can one person really know all this stuff, right? So we've grown up in silos, but in fact, that's not how the body works, right? The brain talks to the body and vice versa, and things that you're doing to the brain are actually affecting your body, whether you realize it or not, or whether the commercial is saying that or not. And the things you're taking in your body are affecting your brain. And so not all medicine, it's not medicine's fault, it's that we become so specialized. But actually, as I said, these things, your heart health, your gut health is your brain health. Your gut is like a little brain. So I think I want to just leave a couple of points that you had asked us to do, which is we keep talking about modifiable things. What can you do? Like, what can you do? What do they mean when they say, oh, 95% of cardiovascular disease is modifiable? What can we do? And I think the main thing that everyone can do is activity. I'll say you need brain activity, cognitive activity, you need physical activity, and you need social activity, social contact, like tonight. What does that mean? Like my mother would tell me that, right? You need to go out, you need to exercise, you need to go to school and learn and blah, 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 right? So now, though, we know a lot of stuff about how that actually affects the physiology of the brain and the body. We used to think that we had all the nerve cells we were ever going to have when we're born, and then as we age, we lose nerve cells, and then we get demented at some point, right, over time. But lo and behold, there are two brain regions that actually can generate new nerve cells. Like when you're 85, you can still generate brain nerve cells in a really important part of the brain. One of them is really important for memory function. So what does this activity do? Brain activity, cognitive activity, physical activity, and even social activity actually can help you generate new nerve cells in a brain region that's one of the critical brain regions for memory function. How cool is that, right? I mean,
so what she means by that exactly is what we were saying today. What does that exactly mean? When you leave here tonight, don't get directions from your phone. Maybe go out the wrong way. Try to find a different way. Brush your teeth with a different hand. Mix it up. Do things differently. Trick with your brain. Try to memorize some phone numbers. Memorize a recipe. Learn a new instrument. Try to find your way in a neighborhood you haven't been to, right? These are things you can do that stress the brain, right? Mm-hmm. And also, I was speaking to a doctor recently who said one of the most important things, we talk about sleep, exercise, food, but also love. And I loved this because the idea that connection between human beings, we're facing an epidemic of loneliness in this country, and one of the things that people lose jobs at 50, they don't, kids leave, you wonder about your purpose and all that sort of stuff. You isolate, you become lonely, and that is devastating to the brain.
Yeah. I agree. Love is good, said the neuroscientist.
You need a lot of degrees to know that.
And again, it is. Social connection, staying socially active is clearly good for the brain. Even in the presence of plaques and tangles in the brain, and there are studies that have looked at this very question. In the presence of plaques and tangles in the brain, a person who's socially active performs better on cognitive tests than a person who is socially isolated. So even in the presence of a brain disease, social activity can be therapeutic. And all the other things that you said are true as well. And staying physically active eating a heart-healthy diet, getting consumption of fish regularly, all these things are good. And then, I would just say that we're all lucky to live in a state that is, importantly, disproportionately affected by Alzheimer's disease. California is home to more people with Alzheimer's disease than other state, and disproportionately home to researchers. And we have 6 Alzheimer's disease research centers in the state of California, and we're thrilled that under your leadership, the governor has recently announced that he's going to start funding Alzheimer's disease research in the state of California. And I like to tell people that, we do hear about failures in Alzheimer's disease research in the news, but I like to remind people or educate them that we've been studying cancer and heart disease for hundreds of years. And we really only entered a modern era of Alzheimer's disease research to be liberal about it 30 years ago. And the rate at which we're learning is so accelerated that I'm incredibly hopeful and optimistic that we're absolutely going to change the ability to prevent this disease and the ability to treat it in people who get it, and that makes me hopeful.
That's great. So we, as I said, Josh and Jill are both, they're both on Scientific Advisory Committee of the Women's Alzheimer's Movement. They're both doing extraordinary research, both moving the needle, looking at this disease in ways that other people had not looked at it, and it's really exciting. So we wanted to open up to everybody who spent money and made the effort to come here, the opportunity to ask them questions. You can talk about supplements, you can talk about what you should be doing and what your questions are. So if you have any, go ahead.
I do have a question. So I lost my mother-in-law of cancer.
Okay,
Yeah, it's fine. It's fine. I'm pretty loud, actually.
Yeah, go.
Everybody here knows me, knows I'm loud. So when she passed away, my mother-in-law, Larry's mother, we were told by doctors, by a lot of people, that because she took hormone replacement drugs, they thought that may have given her cancer. So for me, I'm 50 now, and I'm nervous to take hormone medication, even though I know I'm going to need it. So this conversation opened that up for me, because I'm hearing now that that may not be the case, or not. I'm not sure. If you could please answer that. And thank you.
I don't know what type of cancer it was or what her risk factors were. But as Maria said, I think, in personalized medicine, a lot of these things are individual. So I'm happy to chat with you after offline. But the hormones themselves are not going to produce cancer. I mean, there are estrogen receptors all over the body. That is true. But depending on the route of administration, the timing that she took it, what her condition was to begin with, and what other medical illnesses she may have had, all may have contributed to the onset of cancer. But hormones themselves do not produce cancer. In fact, for breast cancer, everybody, there was we shouldn't be taking, estradiol or hormone replacement because of the breast cancer. But in fact, what they found out, that it wasn't the estradiol, the estrogen form, that was actually producing or causing a risk for breast cancer, but it was actually a progesterone. So, and not the estradiol. So these things are extremely complicated, and what works for some will not work for others. So this is why you need to talk to you need to require your physicians to learn about these things. It's very important. So what was not good for your mother may be absolutely fine for you, and it's really important to find those things out.
Mm-hmm. Go.
I'm sorry. So for follow-up for that, are there tests yet for trying to indicate Alzheimer's?
Well, there was a recent blood. There are no actual tests for Alzheimer's before, But there is some recent evidence that there is a recent blood test that we're hopeful will actually be able to give us some evidence that this will occur. Alzheimer's disease, by the way, is really complicated. It's not all one cause, and that's a really important thing. That's why we can attack it from different venues in order to prevent it. But also, it would be wonderful if we had early identification. So we're all about early identification. The Women's Alzheimer's Movement is. We're about it in our science, and we think that we can tackle these things to prevent it. I'll say just in terms of the research, you are extremely lucky that your governor has funded actual research for this, because if you look at the curves for the National Institute of Health for the amount of money that's gone into cardiovascular disease and cancer, for example, you will see the death rates incredibly fall like this. Money into research like this, death rates like this. Alzheimer's disease for many years had about $500 million like this. And it's with people like Maria's movement and other people that have really forced Congress, and there's some fantastic people in Congress who actually pushed increased funding for Alzheimer's. And so this is one of the reasons why we're going to move the needle, because you've got to know what you're doing in order to translate it into a therapeutic early for prevention.
I just want to, and Josh wants to say something, but I think one of the things I like to always mention is Alzheimer's and caregiving are political issues. They really are. We have to begin to think about voting for people. I don't care if they're Democrats, Republicans, independents, male or female, that understand the importance of funding diseases like Alzheimer's, because it is already a national crisis. It's on track to bankrupt our nation, that single disease. It's bankrupting families all over this country. Caregivers, Josh mentioned, 2/3 are women, people dropping out of work all the time, every day, to care for parent. 40 million people in this country today are caregivers, 16 million in the Alzheimer's space alone, 1 million to 10 million in the millennial space. Who are having to drop out to care for parents so they can't financially do it. So this is a huge political issue that I'm glad that the governor here is going to put this several $1 million, and that's just the beginning, as I mentioned to him. That's just the beginning. But he understands that's the beginning, and we're going to keep going. And but it's an important thing when you think about voting for somebody, to ask them, what is their plan for caregivers? What is their national plan for investment in diseases and in science?
I was only going to add that the question sort of alluded to your children, and the blood tests are really exciting. There's several blood tests that are sort of making their way through the research channels now that we hope will be sensitive to picking up when Alzheimer's disease has begun in the brain in that 10 to 15-year window before the symptoms begin. But at this point, not before that. There are 20-some genes that have been identified, and there are direct-to-consumer genetic tests that are out there to test for one genetic risk factor for Alzheimer's disease. And people in the field differ in opinion about this. I'm not a paternalist. I think people should have a right to know about their own genes, and you can do that now through direct-to-consumer. But I like to educate people that if you're thinking about doing that, that you seek counseling before you make the decision to undergo that test, and that you make a plan to get genetic counseling after receiving the results. I know a person who underwent that test and literally was diagnosed with post-traumatic stress disorder because she wasn't educated, and she wasn't educated after the fact, and she over-interpreted, because there's no genetic test to tell us who's going to get Alzheimer's disease and who won't. And there's no difference in any of the recommendations we've made up here tonight based on those genetic results. We hope someday to get there, to be making personalized medicine an approach. But right now, brain health is brain health, and we make the same recommendations to people who have certain genes versus other genes. So I think that gets at, especially for younger people, where I'm thrilled that more and more younger people are interested in working with us and learning about this. And one of the things we're asked all the time is, can I learn my Alzheimer's genes? And there is no Alzheimer's gene. It's very complex. We're trying very hard to figure it out in hopes that it'll be used for personalized medicine. And right now, it's all about brain health and lowering your risk.
There was some, go ahead. Go.
Hi. I got it, Johnny. I'd like to combine a couple topics that were just, it's okay, I'm also loud. Combine a couple topics that were just brought up. One is, the politics behind this. Medicare does not currently cover caretakers nor Alzheimer's care, which I think is a huge issue considering the risk factor association with cardiovascular disease, diabetes, and all these other things that heavily burden the current Medicare policy. And then that combination with environmental versus genetic risk factors and how that plays out. You were talking about pregnancy and can we detect Alzheimer's in pregnant women, let alone fetuses and things like that? And how do you guys see that playing into the future? And how will Alzheimer's then affect Medicare policy, politics in the future? And, think about the politics more so with defunding of Planned Parenthood and things like that. How does the money play out, not just in supporting caretakers, the current Alzheimer's movement, but then research, the future of diagnosis and stuff like that? That was a big question.
Well, that was a big question. Let's see. Do you have a couple of months? Okay. All right. I will say something. I'll just simplify it. I think women's health is economic health. I just wanted to underscore what Maria was saying, that women are the primary healthcare utilizers. They bring their families into healthcare utilization. They drive healthcare utilization, which is a huge portion of our gross national product. So women's health and maintaining women's health is also about maintaining the health of the family, which is also about maintaining the health of workers in the country, which is our economic health. And so women leaving the workforce to take care of their ill relatives are 40 and 50 years old. They're at like the peak productivity in companies. Companies should be concerned that they are going to lose their women workers who are at the height of their productivity. You cannot get that back, all that experience, in a year or two or in 5 years when they return to the workforce. So it's an economic crisis, and I think when it's spoken like that and turned into that heads will turn and that businesses will address this aside from the government. I mean, we need business to really understand the consequences of this. Japan is going down the tubes. I mean, if we do not tackle Alzheimer's disease, these super aging countries like Japan, Germany, they are extremely concerned about their economic survival with Alzheimer's disease.
And I would only add that you're absolutely right. These are very real issues. They are here now. The Medicare issue is here now. We have been winning battles, but the war is ongoing. The NIH dollars have increased. That's wonderful. This news about California is wonderful, but there is still an incredible need for advocacy. So my advice is to join Maria and do whatever she tells you to do.
I think what Josh is saying, we're talking about political businesses. I go around speaking to businesses all the time, and they're now having to address this exact issue. Workers needing flexible hours, workers who need caregiving policies. What is maternal parental leave? How do we include that for elder leave? So this is really a big, as Josh said, advocacy. We could use your help. It's financial, it's political, it's emotional, it's spiritual, and you got the floor.
Thanks, Maria. In the process of writing a New York Times bestselling book about brain health, I interviewed Dr. Paul Newhouse from Vanderbilt University, who wrote the first paper in 1988 about using oral nicotine, not smoking, to treat Alzheimer's disease. I've heard through the grapevine that Larry and Sergey use nicotine patches. I've added 1 milligram of nicotine every day to my plan to live to 180. My question for you.
Are you sure?
Yes. My question for you, should I put a low-dose nicotine patch on my 97-year-old former nuclear engineer grandmother? Because I'm thinking about it.
Who are you asking? Does she
I'll let you take that one.
does she have Alzheimer's disease? Yes. So there's a trial ongoing right now that is being conducted, led by Dr. Newhouse, of a transdermal patch, nicotine patch, to see if it can improve the symptoms of Alzheimer's disease. Hopefully by this event next year, we'll know the results, and I can answer emphatically.
That's Dave Asprey, who does Bulletproof Coffee with all his mind stuff, so who's been a big supporter of the women's Alzheimer's movement. We have time for one more question. Go ahead.
I had a follow-up for the first lady who talked about hormones and their effect. I'm wondering whether there's a difference between the hormones that women took, say, a generation ago and the new bioidenticals. And as a follow-up to that, what are the nutritional recommendations now that there have been so many discoveries in the mind-gut connection?
As far as, you're absolutely right. Hormones that were taken many years ago were much stronger, and now we use much lower doses. Also, they were oral, so they go through the liver, which gets metabolized in the liver. It has much stronger effects on other organs in the body, but the transdermal patch has been found to be, less deleterious, let's say, as a route of administration. So the administration, the timing has changed, and the dose definitely has changed. But these should all be individually in the personalized medicine arena here. They need to be individually tailored to the woman, her risk factors, and both her genetic but also her other risk factors really need to be taken into account. What was the second half of that question? One was hormones. Nutrition, bioidenticals. Yeah. Gut. Yes. The gut is a mini brain. Like the gut has the most immune, let's say, for our immune system, it has some of the most powerful factors that help us in our immune system are actually in the gut. And the brain talks to the gut, by the way. And that same way that the brain electrically talks to the heart, which is through the vagus nerve, that vagus nerve, which is the main electrical conduit from the brain to the heart, goes into the gut. And so regulating things, stress, mood, anxiety, there are reasons for why the gut is involved as well. And really important for our immune physiology to tackle that. So in thinking about things you're eating, things you're ingesting, these are part of the reason why there's a whole movement now about taking probiotics and figuring out how your gut can contribute. The bacteria actually are good things. They do good things as well as bad things.
Following up on that, this question over here. Is there something, you've covered so many different sectors of our life that we need to address. Is there one dietary suggestion, in addition to probiotics, that we should be ingesting?
If I had to pick one, I would say make sure you eat fish, unless you have a fish allergy, and then talk to a physician about how to deal with not being able to eat fish. I find the research on fish consumption throughout the course of life and the risk for late life brain problems to be the most compelling from a single dietary recommendation.
I asked you to talk first about inflammation.
And I would love to
well.
say that from a gut and other perspective, we were taught that the brain is got its own sort of defense system from inflammation, and now that is largely no longer believed to be the case. Among the 20 genes that have been identified that impact Alzheimer's risk, several of them actually point to inflammation in the brain. And at UCI Mind, I have colleagues who strongly disagree whether inflammation is a product of the disease or a cause of the disease. And I think one other thing I'd like to bring up about it is I like to make the parallel to HIV, and we were doing it earlier in the evening out in the audience, that we didn't really change HIV from a deadly disease to a chronic condition until we had 3 drugs and we used them in a cocktail. And it may be that we need a cocktail to beat Alzheimer's disease, something against the plaques, something against the tangles, and something against inflammation. And so, another reason that I'm really hopeful is that, the amyloid therapies are coming along, that there's great promise, and we're finally starting to get anti-tangle therapies, and there are a number of therapeutic targets on the inflammatory side that could ultimately be really important, and that may also be important to lowering our risk by changing our lifestyle throughout young and midlife.
Okay, Joe wants to say more things, but you're not gonna get it because we're gonna close and you can go into the audience. She wants to talk about Dietary, but I wanna thank all of you so much for coming. I wanna introduce Erin Stein, who's the Executive Director of the Women's Alzheimer's Movement.
Thank you, Maria. Thank you, Jill. Thank you, Josh.